Hello everyone. In this video, we will talk about lupus, and role of a balanced diet in the treatment of lupus. Lupus is an autoimmune disease that occurs when body's immune system attacks its own healthy tissues and organs. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart and lungs. There are 4 types of lupus: neonatal, discoid, systemic, and drug-induced lupus. Today, we will discuss about systemic lupus erythematosus in detail. Systemic lupus erythematosus is the most common type of lupus. It can affect the skin, joints, kidneys, brain, lungs and other major organs of the body. As you can see in the picture, systemic lupus can cause many complications in the targeted organ. Patients may also notice heavy hair fall, high fever, severe abdominal pain, and abnormal headaches. It may occur at any age. However, it appears most often in young women between the ages of 15 and 44 years. It is more common for women than men. 1 to 2 million people have lupus, especially Latino, African, American, and Native American women, with the onset in the late teens to 30s. Major causes of systemic lupus are genetic factors, environmental factors, hormonal problems, and certain medicines. Environmental triggers may include trauma, physical or emotional stress, certain viruses, etc. The signs and symptoms of lupus that patients experience will depend on the body systems which are affected by the disease. The most common signs and symptoms include fatigue, fever, joint pain, stiffness and swelling, butterfly-shaped rash on the face that covers the cheeks and bridge of the nose or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. Eating an anti-inflammatory diet can help offset some of the complications of systemic lupus. Foods like olive oil, vegetables, such as tomatoes and leafy greens, nuts, such as walnuts and almonds, fatty fish, such as salmon and mackerel, fruits like berries, grapes, apple, pomegranate etc. All types of beans and lentils. Spices, such as ginger, turmeric and curcumin, yogurt, and green tea are included. Some studies suggest that omega-3s may reduce lupus activity in the body. Fatty fish like salmon, tuna, sardines, chia seeds, walnuts, olive oil, and flax seeds are rich in omega-3 fatty acids. Different drugs that patients take to control lupus can thin their bones. This side effect makes you more vulnerable to fractures. To combat fractures, eat foods high in calcium and vitamin D. Calcium-rich foods include milk or soy milk, cheese, yogurt etc. Like calcium, vitamin D is also very important to combat fractures. Vitamin D-rich foods include milk, mushrooms, egg yolk etc. Add high-fiber foods in diets such as whole grain wheat, oats, brown rice etc. Plant-based foods such as vegetables and fruits tend to be high in polyphenols. Top rich source of polyphenols include sweet cherries, cloves, dark chocolate, berries, apple, olives, soy products, spinach, grapes, and flax seeds. Avoid foods like processed meats or meat with a high saturated fat content, such as sausages, hot dogs, bacon, pork, spare ribs, red meat, lard, margarine, and shortening, sweets, cakes, biscuits, and baked goods, frozen meals, ultra-processed packaged foods, and fast food. High-sugar breakfast cereals, sodas and sugar-sweetened drinks, alcohol, sugar and fat-laden dressings, sauces, and syrups.